Great. Well, it looks like we have a lot of people on the line, so we'll go ahead and get started. Hello and welcome everyone. I'm Liz Jordan with USAID Center for Water Security, Sanitation, and Hygiene. It's really great to see so many of you joining us today for this webinar. Today's presentation is a summary of work we've been undertaking for a number of years to better understand sustainability in the WASH sector. This presentation is going to discuss the synthesis of findings from a series of 6 ex-post evaluations conducted by Social Impact on USAID-funded water and sanitation activities. Our speakers today will be Holly Dentz, Leslie Greene Hodel, and Kari Nelson from USAID's Water Communications and Knowledge Management activity. Abby Jones from USAID will speak at the end of the presentation about USAID's reflections on the series and where we are going next. Before we get started, I just want to run through a couple things about the webinar platform. We really want to hear from you, and we want to include your voice in the conversation. So please ask questions, share comments, or even challenge our ideas. To do so, you can use the question panel on the right side of your GoToWebinar player to share at any time during the webinar. Note that questions won't be answered until we hear from all of the speakers, but I will be organizing and grouping the questions and comments throughout. We're intending to leave plenty of time at the end of the presentation for questions and discussions, so we hope to hear a lot from you. I also want to flag for you that you can find the synthesis report and executive summary under the handout setting, as well as the slides from today's presentation. For the materials from this and all of the other ex-post evaluations, please go to globalwaters.org. Today's webinar is being recorded and will also be uploaded onto Global Waters in the coming week. If you're having any technical issues during the webinar, our technical team will do their best to assist you, and they'll be monitoring the question box for any issues that you highlight. Let's go to the next slide. So I want to start with just a little bit of the history of this series and our motivation for doing this. The sustainability challenge in the WASH sector is well known. I'm sure everyone on this webinar today has heard some of these statistics. The statistics about the failure of WASH interventions to lead to sustainable services are not new by any means. Many studies in the early 2000s pointed to widespread failure of infrastructure and behavior change following interventions. Much of this work focused on rural water services, especially hand pumps, and sanitation behavior change programs. These studies show that about 40% of hand pumps were failing within a few years of installation, and latrines were going unused, or communities were reverting to open defecation. So in 2012, USAID and Rotary International developed the Sustainability Index tool, designed to predict whether outcomes from projects would be sustainable. That tool assessed institutional, financial, management, technical, and environmental factors to come up with a score for how likely it was for the outcomes to be sustained. Findings from implementation of this tool pointed to insufficient attention to finance and institutions, resulting in risks to sustainability. This type of information has been instrumental in shifting organizations, including USAID, away from direct service provision to a more systemic approach to sustainable WASH service delivery over the long term. USAID's activities have long worked to address the financial, institutional, and environmental constraints that could affect services. Yet that tool and other sustainability assessments available in the sector are not able to tell us what happens to services beyond the life of donor-funded intervention. So USAID made a commitment in 2013 in our first water and development strategy to invest in longer-term evaluation beyond our typical 5-year activity cycle. Next slide. That commitment we made in the strategy led us to our main question for this series of evaluations. To what extent were outcomes of USAID-funded WASH activities sustained after project close? To that end, we selected 6 different USAID programs that had closed between 3 and 10 years ago, which you can see here on the map. We aimed to include activities from different regions and from both rural and urban settings, covering water, sanitation, and hygiene interventions. Our goal for this was to determine what is happening to our investments after projects end, and much more importantly, why. By undertaking evaluations with robust qualitative data collection, we really hope to understand the causes for both failures and successes to inform our future programming and facilitate better uptake of our interventions within local systems. At this point, I'll turn it over to Holly Dentz to begin presenting the findings from the series.
Great. Thank you, Liz, and apologies to everyone for my voice. I've been a little under the weather. So thank you for the motivation and introduction. It was very helpful. I want to again extend a warm welcome to all of you joining us today. We're pleased to share the synthesis of our ex-post evaluation findings with you. As you can see on your screen, we're going to walk you through a pretty standard presentation format. First, we'll start with a background of the Expo series. Then we'll share concise key findings with you to start off, to frame. And then after that, we'll dig a little bit deeper into details of finance, governance, management, and sanitation and hygiene demand and behavior change. And then we'll wrap up with USAID's response, and then a question and answer session. Next slide, please. So now I'll give you a brief overview of the activities that we evaluated. To start with, we'll address the more specific interventions later. This is really meant to be a brief overview of the years and basic topics that we're covering. So to start with, in Ethiopia, we evaluated the MWA EP activity, which ended in 2009. Our evaluation took place 8 years after the activities closed, and the MWA EP activity aimed to improve WASH access in rural areas in particular. Next, we evaluated the Fire D activity. So next slide, the Fire D activity in India. It was a long-running activity that went from 1994 to 2011, so a little bit longer of a cycle than traditional activities. Specifically, the implementer worked to capacitate local stakeholders to plan, to manage, and finance urban water and sanitation development. And we visited this activity 7 years after it took place. Next slide. In terms of our next activity we evaluated, it was in Indonesia. It was again in an urban setting, and we evaluated the ESP activity that aimed to improve and expand safe water access in urban areas with a focus on support to utilities. It is worth noting that this activity also had a fairly large water resource management component that we did not assess during our evaluation. And for this evaluation, we went back 7 years ex post. Next slide. Next, we went to Madagascar. So for that, in Madagascar, we evaluated the Rano HP activity that ended in 2013. And specifically, that activity worked to improve WASH access primarily in rural areas. It is worth noting that our evaluation addressed the sanitation and hygiene components here. And there was a water evaluation that was carried out by a different entity. And we did visit this 3 years ex post, so that was the most recent of the evaluations we visited. Next slide. And then after that, we went and evaluated the SKIP activity in Mozambique. That activity ended in 2015. And a bit different than the other rural activities we've talked about. It was a large integration activity that had WASH with other health nutrition components, as well as economic growth interventions, and it was carried out primarily in rural communities. We focused specifically on the Zambezia province where the SKIP activity was implemented, and our ex-post evaluation occurred 4 years after the fact. And finally, the sixth ex-post evaluation took place in Senegal, where we evaluated the PEPM USAID activity. It ended in 2014, and it aimed to improve WASH access in rural and peri-urban areas. And our evaluation occurred 4 years ex-post, similar to SKIP activity. I did want to briefly note, if you look at the red kind of highlighting on your screen, that just denotes that these activities were in urban settings. And while some of the activities we addressed in Mozambique and Senegal were in peri-urban settings, the interventions evaluated were more aligned with rural community-based management models for water service delivery. So in this presentation, we do refer to them with the rural results. So now that we have a basic overview of the background of our ex-post evaluation sites, we're going to move on to the next slide and discuss the design and methods in particular. So across all 6 ex-post sites, we conducted mixed methods performance evaluation. These evaluations could include a combination of methods, which included surveys, qualitative interviews, structured observations, and water quality testing. We did those as appropriate to the activities that were carried out. And then also, where possible, we used M9 data as a form of comparison, although it wasn't always possible for us to do so. So specifically, we used direct comparison in Madagascar with an end-line survey that was carried out by the implementers. Our data was replicated in the same sampled villages as well. In terms of Indonesia, it was a somewhat comparable sample. So we were able to modify and replicate a utility performance index. And then to more limited extent in Mozambique, we compared data from a nearly end-line random sample of households to a non-random sample that we carried out at ex post. And for the other sites where possible, we use secondary data if it was available, survey responses to recall questions, and reasonable assumptions. So for example, that all rural water points were assumed functional at endline. And we carried out these activities to essentially infer changes since endline. But of course, they're not directly comparable. In terms of our sampling strategy, we excluded sites with known contamination from WASH activities. So that would be some sort of follow-on WASH activity in the same area or village. Sites without sufficient implementation detail, and then inaccessible locations as well. Certainly, this is a very broad overview. So please note that there are a lot of details and very long reports and very brief summaries that you can read on Global Waters if you want to dig into more details. And we're also happy to present or give more nuance during the question and answer. I'll now hand it over to my colleague Leslie, who will share an overview on the key findings from the evaluation. Thank you.
Thanks, Holly. So in each evaluation of our series, we first determine the present status of WASH access. In terms of access to water, we found that many community water points that had been constructed or rehabilitated through USAID funding had unfortunately failed. And as you'll see in the graph, only 44 to 65% were still functioning at ex post. You'll recall Liz kicked off the presentation referencing a study that around 40% of hand pumps fail within a few years. So this is somewhat in line with those findings. And I will point out that you might recall Ethiopia observations were 8 years ex post, whereas Mozambique and Senegal were 4 years ex post. So that could be one factor in the difference between these countries here. And moving on to our urban evaluation contexts, utilities, oh, sorry, go back, please. Thanks. Utilities supported by the ESP activity in Indonesia did fairly well. Water connections increased in 6 of the 8 utility catchment areas we evaluated. And this moved them from an average of 35 to 43% population coverage over the 5-year follow-up period. In India, changes in piped water access varied pretty widely across the 6 municipalities we studied. So 2 studies increased the proportion of households with water access in the past 4 to 5 years, whereas the 4 other cities kept relatively constant coverage levels. Keep in mind there was population growth in that time, so maintaining the same coverage level likely reflects some degree of service extension. Next slide, please. So now I'll turn to hand washing, where of course the goal is to achieve habitual hand washing with soap. We observed whether households had a hand washing facility with soap and water, which is a pretty good proxy for this behavior, and also the main JMP indicator for hand washing. Overall, we found very low evidence of hand washing at ex post, ranging from 0 in Ethiopia to 31% in Senegal. In Madagascar, this 2% figure reflects a statistically significant decline from the 8% prevalence measured at endline. So beyond the slippage, it's important to point out that this activity wasn't able to achieve substantial behavior change to begin with. In the other settings, without directly comparable endline data, it's unfortunately a bit hard to know if these numbers reflect declines or improvements, but needless to say, one would hope that to see higher prevalence of hand washing overall. And then in all these settings, the USAID implementers promoted tippy-tap hardware, which is shown in this figure here, and we found virtually none still existed. And we'll share a little bit later a little bit more about this. Next slide, please. So what about sanitation? Here you see those with at least basic sanitation access in the 3 settings where we did larger scale household observations and surveys. So basic sanitation access refers to non-shared improved facilities, which in most cases were pit latrines with slabs. Out of the 3, Senegal clearly fared the best, although we unfortunately don't know if this is worse or better than when the activity ended for lack of endline comparable data. Our loosely comparable N-line data in Mozambique suggests that this 14% basic sanitation figure actually represents an increase, or sorry, 15% actually represents an increase over the past 4 years, up from around 5%. So that's somewhat encouraging, although 14% still is quite low. In Madagascar, basic sanitation access at N-line was 3%, so you can see this didn't really change in the past 3 years. In all of these settings, community-led total sanitation was the main sanitation promotion approach. And as many of you on this call know, CLTS tries to mobilize community-wide elimination of open defecation. Based on our surveys, observations, and in the case of Madagascar, we did an open defecation-free verification exercise. We found that open defecation was still unfortunately occurring in nearly all the rural settings we visited. So the CLTS goal wasn't met in the long term. I will point out that in Senegal, 92% of households reported using latrines. So these communities did retain pretty high latrine coverage in a sense, but many were shared or poor quality. So they didn't meet the basic sanitation standard that's thought to be important for reducing disease risk. This isn't shown on the slide, but I'll share that in India, once again, we found a mixed bag. One city had a big increase in sewerage connection coverage, another had substantial declines, and 3 remained relatively constant over the past few years. In the coming sections of the webinar, we'll get more into our other findings to address why some of these conditions were observed and what might be driving these results. Next slide, please. So I'll get that started by addressing finance. USAID has identified finance as a critical factor that underpins sustainability in the WASH sector. And there's a pretty large gap in financing WASH priorities across the developing world. It's seen as a key barrier. It prevents countries from expanding access, improving service delivery, meeting universal access targets that we all know are associated with the SDGs or national WASH strategies. So we took a look at the status of finance in our Expo series and the long-term results of finance-related interventions. Slide, please. Thanks. Overall, we found that cost recovery for water service providers was a universal challenge across all sites. In predominantly rural areas where water points were managed by community committees, virtually none had sufficient funds to cover expenses. In Indonesia, urban utilities experienced a decline in various indicators of financial performance in the past 7 years. In India, again, it was a mixed story depending on the municipality. In one case, you have Pune, a city in Maharashtra state, which had a revenue surplus, a AA+ credit rating, so things were going great there. But in contrast, Lucknow in Uttar Pradesh state was unable to cover operation and maintenance costs. So by and large, finance came out as one of the biggest challenges for sustainability. And we'll talk a bit more about that later as well. Next slide, please. The 6 activities we evaluated offered a variety of finance-related interventions to learn from, ranging from efforts to improve financial management, to cost recovery, accessing market-based sources of finance, improving household-level finance. So I'll share more details about what specifically these interventions entailed in the coming slides. Next slide. But first, we're going to pause, try to take a break from us talking so much and give you a chance to respond. We're curious, what interventions do you think are most likely to increase service provider finance? So looking at these options, I think you should get a prompt on your screen. There you go. So just curious, what do you think before we get into some of our findings? What do you think is the most likely to increase finance? And we'll give you a few minutes. I see results coming in. I think polling is on all of our minds lately, at least if you're in the US. It looks like a fairly even split. I know it's a little bit difficult to just choose one. And of course, there are many other types of interventions beyond these. Okay, so it looks like yeah, nearly balanced across all of these. This is really interesting. All right, well, I think we can move on. Oh yeah, there we go. There's the final results. So it looks like a slight edge for cost recovery improvements through technology or reforms. All right, well, let's dive into our results and we can show you what we learned in our limited context we were able to study. Okay, so across the ex post evaluation series, we concluded that technical assistance to improve financial management and business planning had mixed long-term success that essentially depended on the enabling environment. Looking at India first, FIRE-D tried to improve financial management, not of utilities, but of states and municipalities. And this took the form of introducing double entry accrual-based accounting systems and supporting improved cost recovery through things like tax reform and e-governance. We found all these interventions largely persisted and even expanded to other locations. And this was primarily because the government of India had adopted FIRE-D supported reforms and manuals into its major urban development funding schemes. And this was by design. FIRE-D's model was to work closely with the government to pilot practices and then support the government in adopting them. In our rural settings, financial management support took the form of helping community-based water management committees set up bank accounts and training them on transparent accounting. These were fairly common approaches at the time, I think. And by and large, this either wasn't sustained or didn't seem to have an impact on helping achieve sustainable finance. For example, in Senegal, none of the 8 water committees we studied in depth had transparent records. USAID had supported business planning in Indonesia and Madagascar with some limited success. These are basically plans to do things like set service level targets, prioritize projects, or identify revenue sources and allocation. And business plans can be used to solicit funding for service improvements, among other things. We found that 2 utilities in Indonesia praised the long-term impact of their business plans. And in Madagascar, only 1 out of 6 districts that we studied used their business plan. And you might remember that there was a political coup in 2009, which is right when Rhino HP was getting started. So government donor and other funding largely dried up as a part of the fallout of that. So it seemed the main issue there was that even the best laid plans won't go anywhere without a way to fund them. Next slide. We found that technology interventions were pretty successful overall in facilitating durable improvements in financial management. In India, FIRE-D supported e-governance tools that let utility customers do things like pay bills, report leaks, and register complaints. These systems persisted and stakeholders valued them. And they'd also been scaled across many other locations nationwide since the national government adopted them into its WASH funding schemes. And probably there's also a bit of inevitability that as technology improves, it's more common to kind of adopt those electronic-based processes. Similarly, Indonesian utilities for which ESP provided improved meter reading technology and non-revenue water capture protocols reported that they were still using those resources, and they credited them with documented reductions to their non-revenue water rate. So ongoing benefit there. By and large, technology-based improvements had long-term gains, at least the ones that we were able to study. Next slide. In Indonesia and India, the implementers worked to enhance utilities and municipalities' creditworthiness and consequently access market-based finance. That was a plan. So we looked at how these efforts shook out in the long term. And we found that, again, success depended on the enabling environment. One Indonesian utility that ESP helped get a credit rating said that it led to them getting a commercial loan, which they used to build a water treatment plant. So that did pan out. In several India locations, FIRE-D piloted municipal credit ratings and subsequent municipal and state bonds. And we learned the process of getting credit ratings continued after FIRE-D ended and also occurred in many other cities. But in most cases, cities only did it to meet a milestone requirement to access government grants. Credit ratings as a pathway to market finance didn't materialize in most cases. And the main reasons for this that we found were that with India having urban development funding schemes like Swachh Bharat and Amrit that offer grants, there wasn't much incentive to jump through the administrative hoops to float a bond when cash could come more easily from other sources. And besides this, many cities didn't reach the financial stability to get an investment grade rating anyway. Well, this was the broad trend in India. Some cases, in fact, were successful. 2 out of 3 sites that FIRE-D helped float municipal bonds had indeed continued to issue them. And the thing that made these cases different was the fact that they had a strong financial stability that allowed them to leverage that to float the bonds. Across the interventions I've been discussing in the past few slides, I'll say that a common theme or conclusion we've come to is that while some interventions themselves endured or had promise, the underlying theory of change was often validated, but without the right enabling environment, they just weren't enough on their own to facilitate self-sufficiency. Next slide. So finally, in terms of finance, I'll zoom in a bit on household level finance interventions. We found that while they're potentially important and at times sustainable, they didn't really drive widespread sustainable access. Microfinance loans for improved sanitation in Madagascar were still available and used 3 years later. However, they were only really available in more urban areas where conditions were more favorable. And microloans for water connections in Indonesia were not sustained. In this case, the main participating bank wasn't really used to lending to poor clients with such small scale loans, and its criteria to assess creditworthiness were too stringent and burdensome for this population. So sadly, these loans never really even got off the ground in many cases. We learned that the Indonesian utilities also offered connection discounts in the time after ESP ended, but they also didn't last when customers frequently defaulted. In Madagascar, we found village savings and loan associations that were established by Rano HP were by and large still active. And I should say their focus wasn't exclusively on WASH. They were used for a variety of household needs. But our survey data found that 17% of members claimed to have used their VSLA funds to improve their household WASH conditions in the 3 years since Rano HP ended. So certainly there's some modest ongoing value there in terms of WASH. In the end, none of these options put a large dent in WASH outcomes across targeted communities. And I'll harken back to the WASH access results I presented earlier. So that's not to say they're not useful interventions. And of course, from the perspective of the families that use these resources, it obviously made a difference for them. When you're looking at the larger scale, they didn't have a large scale impact. And I'll mention that a critical household finance intervention that's missing here is subsidies. We'll discuss sanitation subsidies later in the webinar. But for now, I'll hand it over to Kari to share some findings on governance and management.
Thanks, Leslie. So starting off with governance, as Leslie highlighted, the enabling environment for WASH really kind of undergirds long-term success. And so governance is a key part of that. The policies and the practices that underline the WASH sector in a given country really will be there to either support or potentially hinder long-term success. Next slide, please. To discuss a little bit the governance interventions that we evaluated. So in most of the countries, there was some level of guidance or training regarding tariff and water user fee setting. However, in terms of other types of policy interventions, India was the main example in our ex post series. So in India, they piloted and rolled out support for policy reforms and improved practices, as well as capacity support at the national and local levels. Next slide, please. So one of the key things that we found regarding policy reforms is that a strong government commitment is really necessary. So this came very apparent in the FIRE-D example, where the piloted reforms not only persisted where they were implemented under FIRE-D, but they were actually expanded to additional cities after the activity closed. And through the evaluation, the key aspect that really seemed to be driving this success was the long-term partnership with a committed government. And what the government had done is they actually rolled the FIRE-D reforms into the urban development schemes that were also underway. And so in that way, they were able to help expand where these policies were being implemented. Next slide, please. The next key finding that we have doesn't relate directly to a particular intervention that we studied, but rather came out as a factor affecting sustainability. Even though the activities themselves had not attempted to address it, it did come out as, well, in this case, mostly a challenging factor. So that is unclear roles and responsibilities regarding WASH. And we found that this really was a stumbling block for long-term sustainability. So this was particularly apparent in Mozambique and Ethiopia, where we found unclear roles and responsibilities regarding water maintenance, repairs, as well as water quality testing. And so when it's unclear, you know, who's responsible for maintaining a water point, who's responsible for repairs, and in particular, which repairs, it really opens up the possibility for things to fall through the cracks. And that's what we ended up finding in Mozambique and Ethiopia. In addition to just being clear about whose role and whose responsibility is it to do each of these things, it's also important to make sure that there's actual capacity to undertake those roles and responsibilities. And we found this to be a challenge in many cases as well. So in India, Ethiopia, and Mozambique, we found that just a lack of personnel, just insufficient numbers of people for the expansive tasks that they had before them. You know, if you have 1,000 water points in your jurisdiction and you have 3 staff members, that may very well not be sufficient for you to be able to provide adequate support to all of those water points. In India, we also found challenges regarding a lack of decentralized financial control, as well as decision-making autonomy. And so that also inhibited their ability to actively undertake and effectively implement their roles and responsibilities. In India, there was actually an activity with city manager associations to try and provide capacity support to try and address this issue. And we found that in some cases, the associations were able to continue carrying out that role, but that in other cases, they weren't. And in the cases where they had challenges, we found that unclear mandates and bylaws were one of the key stumbling blocks, which kind of harks back to the initial point about just clear roles and responsibilities. Next slide, please. The next key finding that we had in this series related to water tariff policies. And we found that unclear policies tend to lead to varied tariffs and contribute to inadequate cost recovery. So across the board, we found that water tariffs are often set below cost recovery levels. This was true in all of the rural settings, as well as many of the India sites as well. Now, often the low tariffs are often driven by political and social pressures to keep tariffs low. And certainly this is understandable given the relative poverty levels within the countries. However, we also found a number of studies that are starting to look at people's willingness to pay. And many of these studies suggest that kind of this underlying assumption actually assumes that people are willing to pay even less than they actually are, which suggests that perhaps kind of this political and social pressure is actually driving tariffs to be lower than actually necessary. And so then that just means cost recovery is that much harder. In all of the rural settings, we found that water tariffs and water fees were kind of set in an ad hoc manner, that each of the activities did provide management entities with some level of guidance or training in setting water fees. However, in practice, it was ultimately left up to the water committees and their respective communities to actually set the fees. And what this resulted in is wide variations in terms of whether they were even collecting water fees. Many communities were not, but then also in terms of how much they were raising. And so you had some communities where maybe they were collecting water fees, but it was a very, very small amount. While other committees, though I don't know that we found very, very many, if any, who felt that they were able to collect sufficient fees to cover all their costs, they were at least able to get closer to that mark. And so there was just really this wide variation that only kind of added to this challenge of cost recovery. In the Indonesia case, there were efforts to improve tariff efficiency, and we found that 5 out of the 8 utilities had actually been able to continue working towards making the tariff sufficient to cover their necessary costs. And so they were actually able to make some improvements in that case. Next slide, please. Now we're going to move on to water management. So this is another key aspect that we looked at in the ex post series. And as Leslie alluded to in those initial findings slides, we did have high rates of non-functionality, something that is echoed within the broader literature. And we all know that just building a water point and leaving it there, that's not going to be sufficient. That you need to have in place the necessary management structures, somebody to monitor it, somebody to collect the water fees or tariffs, somebody to make sure that it gets maintained and make sure it gets repaired when it breaks down. And so those water management arrangements really are key to sustainability. Next slide, please. In terms of the different types of water management interventions covered in the evaluation series, so we had several evaluations that include community-based management for rural water points. We also had a number of cases of public-private partnerships. We also had capacity building for utilities, training of service delivery entities and fee and tariff collection, as well as a few activities where they attempted to strengthen supply chains for spare parts. Next slide, please. Before we jump into the actual findings from this series, we have another poll for everyone. So we'll open that poll here, and the question is, what do you see as the biggest barrier to sustaining rural water services? Lack of spare parts, no funds for repair, lack of technical capacity, or unclear roles in doing repairs? We'll give everyone just a minute here to answer this poll. All right, great. I'm seeing the results flowing in so far. A lack of funds for repairs and unclear roles and responsibilities are kind of coming out as the top responses, with lack of technical capacity and spare parts coming in further down the line. And yes, I hope our findings will be able to speak to this. I know we're specifically going to be talking about some of the financial aspects, and then we'll get into the spare parts as well. All right, next slide, please. So one of the big findings that came out through the series, specific to the rural water interventions, was that community-based management really was not able to sustain long-term water service delivery. We had the high rates of non-functionality that we've kind of touched on a few times. So this is the same chart that you saw earlier, where really, we found very high rates of non-functionality across the board. In terms of the key drivers of this, so one is just age of the infrastructure. So you'll notice in the chart that Ethiopia at 45% is substantially lower than the Mozambique and Senegal cases, which are up in the 60s. And so you might be inclined to be like, oh, what did they do differently in Ethiopia that apparently didn't work as well? Well, it may actually not just be changes in the intervention, but actually just age. That in the Ethiopia case, we were going back 8 years after the end of the intervention, whereas in Mozambique and Senegal, it was only closer to about 4 years. And we actually had a larger data set in the Ethiopia case that looked at an entire zone and all the water points from MWAEP, but then also other activities as well. And they showed similar trends over time that just, I mean, as we all know, as infrastructure ages, it's more likely to break down. And then the second driver, that's where this comes in, so financial resources. As the infrastructure ages, you need to have the financial resources to repair it, to fix it. Eventually, at some point, you probably will have to rehabilitate it. And that was then one of the key constraints that we found. And we actually did some correlation as well as regression analyses where we were able to, and we did find that if the communities were able to, one, collect fees of any amount, and then two, the amounts of the fees, that did seem to be a key driver of the sustainability figures that we found. Unfortunately, we did, across the community-based management entities, we found a very high percentage that didn't collect any fees, or they were only collecting fees when repairs were needed. So this is, they wait until, the pipe breaks or, something happens, and then they try to repair it. But as we all know, maintenance, if you haven't been doing maintenance, which if they're not collecting fees, they probably haven't been able to do maintenance, only makes the need for repairs worse and more costly. And so that's a particular challenge. So here, I mean, we found in terms of those who were not collecting water fees, 40% in Mozambique, 50% in Ethiopia, 67% in Senegal. So really substantially lower, I think, than we would have expected. And so kudos to those who noted the lack of funds in the poll and kind of the significant effect that does have on long-term sustainability. Next slide, please. And now to the point about spare parts. So to build spare parts supply chains really didn't result in better maintenance services. So in Mozambique, they had tried to establish new spare parts suppliers with women's groups. And ultimately, we found that most of those entities had kind of broken apart and they were no longer operating as such. And the key driver for that, we found, was that the activity had focused a lot on building the supply, making sure the supply chain was there, but not so much on making sure that the demand was also there. And so the businesses ultimately fell apart. They didn't have sufficient demand for what they were providing, and it was not sustainable. And overall, we found that really lack of finances was a much larger constraint to maintenance and repair than was spare parts. The people did raise spare parts availability as a challenge in some cases, so it's not a non-issue, but it was not nearly as big of an issue as just the lack of financial means on the parts of water management entities. Next slide, please. Moving on now to public-private partnerships, which can be a potential way of improving overall maintenance, repair, and management. So we found that successful private sector engagement requires good cost recovery, experienced oversight, as well as relationship building. So we had private sector engagement activities in 3 of our evaluations. In Senegal, they tried to create and train maintenance companies who could work with the communities on an ongoing basis, and they set up contracts between the communities and these entities. Here, we found that most of the businesses were still operating, and they largely felt that demand was ongoing. However, they noted that all of the contracts were now defunct. So any kind of contract where the community pays them a regular fee and then the company is going to come in and provide ongoing maintenance, those had all fallen away, and they in favor of just kind of ad hoc arrangements. And the reasons for this we found were some communities failed to honor their payments. There was competition with other repair companies, difficulties finding spare parts, as well as a lack of contract oversight. And so this kind of goes back to the first point, some communities might fail to honor the payments, or in some cases, maybe the companies had failed to provide the full services that they were supposed to. And there really wasn't anyone to enforce those contracts and make sure that both parties abided by what they agreed to. And so that was also cited as a constraint and part of how the contracts fell apart. In Madagascar, they created monoblocks, which you see in the photo here on the slide. So these monoblocks were kind of combinations of water points as well as sanitation facilities, and they were run by private sector entities. So here we found mixed success. In some cases, the monoblocks were still open and operating as intended. In other cases, they had fallen into complete disrepair and really were no longer functioning. And we've found that in the failed sites, the key constraints really were a broken relationship between the private firm and local governments, as well as insufficient cost recovery. And so, this insufficient cost recovery, that's the key incentive for a private sector entity to be involved, is that there is ability to have a price motive, a profit motive, and that in the cases where it fell apart, that did not exist. In India, the few PPP efforts that were tried were ultimately not sustainable. And in this case, we found that stakeholders in general were quite skeptical about just even the idea of doing PPPs in water and sanitation. And then we found that there was poor collection efficiency and inadequate tariffs. So again, kind of similar to what we saw in Madagascar with issues of cost recovery, really that kind of private sector incentive was really undermined, and so contributed to the ultimate failure there. Next slide, please. So now I'm going to hand it back over to my colleague Holly to talk about hygiene and sanitation demand and behavior change.
Great, thank you, Kari. I just want to preface this session or this slide with the acknowledgement that social behavior change messaging and behavioral determinants certainly occur within a larger complex enabling environment, and it certainly includes what my colleagues just spoke about, so governance, finance, structural and market-based factors. And the findings I'm about to share are limited to the activities that were carried out across the ex-post evaluation sites, and they don't necessarily touch on all of these larger factors. And I think another important point is, as a sector, the WASH sector has witnessed kind of sluggish improvements in uptake of hand washing with soap at critical time and sanitation behaviors as well, especially relative to drinking water. And as we as a sector strive to meet the SDGs, it's really critical that we understand why these activities, or even the components of these activities, have or haven't been sustained. And I hope to shed some light on that. Next slide, please. In terms of the interventions evaluated, I would like everyone to keep in mind that these were designed, some 10, even 15 years ago. So quite far back, and I think the sector has come a ways since then. But nonetheless, the FAST approach, which stands for participatory hygiene, sanitation, and transformation, was used across 3 of the evaluation sites, or sorry, all 4 of the evaluation sites. And, FAST has a strong focus on knowledge about diseases and preventative behaviors to improve health. So please keep that in mind as we go through the results in a few slides. And in the case of Senegal, also used with FAST was a self-esteem, associative strengths, resourcefulness, action planning, and responsibility, or SORAR approach. So those were used in tandem in Senegal. And across 3 of the sites, so in Senegal, Mozambique, and Madagascar, tippy taps were promoted from locally available materials and were encouraged to be built by households for hand washing with soap at critical times. And then in terms of sanitation, Leslie already touched on this, but throughout the Expo series, CLTS was used in 3 of the locations. So CLTS, of course, being focused on ending open defecation rapidly and less focused on getting to basic sanitation. And also in Ethiopia, the CLTS approach wasn't used. They used FAST to motivate sanitation behavior change and use. And then in Senegal and Mozambique, CLTS and FAST were used in tandem or together as well. In terms of behavior change agents or communication agents, they were trained both during the activities and also intended to carry out ongoing maintenance after activities ended. So in all rural sites, they were trained on FAST. Where applicable, they were also trained on the CLTS in motivating WASH behavior change, both again in the moment of the activity and then for ongoing purposes. And then there was also a train construction component. So there was support for training of local masons in Madagascar, Senegal, and Mozambique. And the idea was that these local masons would provide ongoing skill construction and repair for latrine building in particular. And then the final intervention that was common among some of the sites was some sort of subsidy or financial assistance approach. And so earlier we touched on the use of microfinance or VSLAs in Madagascar. And then also in Senegal, we had the unique opportunity to assess and look at comparisons of communities that receive traditional CLTS or pure CLTS, a hybrid of CLTS plus a subsidy that was offered a few months after the CLTS triggering occurred, or a subsidized sanitation marketing approach. So we were able to assess those 3. So we'll go to the next slide and start our flash poll. So time to get your opinion. So what interventions do you think are most likely to improve hygiene and or sanitation behaviors or use? A, FAST or SORAR behavior change promotion. B, promotion and installation of tippy taps. Community-led total sanitation. Latrine construction support through training of local masons, or finance for hardware, so subsidies, microfinance, or VSLA. So we'll put that poll up for you, and I look forward to seeing your results come in. I think the sector has a good sense of what's what at this point. All right, oh, this is fun. We'll just give it about 15 more seconds, and then we'll put the results up on the screen for everybody. All right, 5 more seconds. Perfect, thank you. So we have about 62% of you have responded, and what we see is that I think, it's interesting quite a bit, think that, the subsidies or the financing piece is important, but CLTS isn't too far behind. And then the behavior change promotion approach of FAST or SORAR. And then interesting, less so tippy taps. I think that'll be borne out in just a moment to foreshadow a little bit. And then we see the latrine construction support coming in at 3%. So let's move on to the findings, and we'll see how this goes forward. Next slide. Thank you. Perfect. Perfect. So I just want to start out by noting that that you see very clearly here that the figure you've already seen before. It's not new. It's the one that Leslie presented earlier. But I think it's helpful to see on this slide as a reference point to help kind of talk about the why we're seeing these specific results. And so I think Leslie alluded to this earlier, but little hand washing with soap changed during the course of the activity. And so when that's the case, then there's, it's difficult to actually examine sustainability, right? And I think that's borne out in this figure. And so, where fast and tippy-top promotion occurred, there really wasn't much to sustain. And thinking about that as well, the local agent piece, hand washing with soap, it's still being promoted. Absolutely, we found that across the evaluation sites, but results show that it's inadequate, right? We can look at this figure again and still see there's not a lot of hand washing with soap or hand washing stations available with soap. And so what are some of the reasons for this? So one is the resourcing and staffing constraints in Ethiopia. I think Kari touched on that a little bit related to to water management, but it's also the case with behavior change. Agents or communicators in across these evaluation sites, and most especially in Ethiopia. And in many instances, those tasked with communicating WASH messages are also conveying broader health messages. So there could be a crowding effect happening, which limits the ability of these agents to really focus on the WASH drivers or determinants that might be necessary to shift behavior and turn it into habit. And some say that there was a need for more promotion. This was especially the case in Senegal and Ethiopia. This emerged quite strongly. And more promotion could be related to frequency of visits, but also different types of promotion. So not just the same old person coming to visit you every week, month, or whatever it may be, or at a certain meeting, but some sort of, changing up the status quo of what promotion looks like, basically. And then, more likely than anything, though, when we look at these results and what we see, especially taking into account that a lot didn't change during the course of the activity, is that, FAST and really this knowledge-based approach isn't sufficient to address the important underlying behavioral drivers that go into hand washing with soap and kind of the larger enabling environment as well. And so, just this year, there was a systematic review by White and colleagues that concluded that one of the most effective interventions to improve hand washing with soap may be to ensure that there's a fixed, conveniently located hand washing station with soap and water available in an observable setting. So essentially a key to action. And for these activities that we evaluated, tippy-tops were touted to be just that, right? They are a simple design using local materials, and they're also touted for their fixed placement. However, virtually no tippy-tops were observed across all rural sites. And if you look at our sample sizes, especially in Mozambique and Senegal, we're in the 800-900 numbers. It's a fairly large sample size, and we're not finding any tippy-tops. And there are obviously many, I think, known weaknesses, which is probably only 9%, thought that they were a driver of behavior change. But essentially, they're not durable. So, they're made from locally available materials, which would mean, okay, they could be rebuilt easily, but the sense is that there's not that desire to replace them and to keep rebuilding them and going through that cycle of rebuilding. In a majority of the evaluations responses that we looked at in both our observations, people have reverted back to using pitcher and basin for hand washing, which are certainly movable objects. And while it's locally available, tippy-tops are locally available, they may not have that user-centered appeal, right? Because they're not being rebuilt, which we'll talk about a little bit later in sanitation, or at least in rebuilding. Really, in sum, to wrap up the hand washing piece, the social and behavior change programs that focus primarily on knowledge, such as FAST, they didn't work, or they weren't sufficient to move and to address the multidimensional drivers of and structural barriers to behavior change around hand washing with soap at critical times, and really achieving these behaviors both during the activity, let alone sustaining them several years later, is certainly one of the biggest challenges that the sector is facing in terms of WASH. So we'll now move on to the next slide and discuss our sanitation findings. First, kind of the main takeaway here, you can see from the red letters, is CLTS didn't eliminate open defecation, which Leslie shared, in the long term, and the health benefits were likely not realized because of this. And so, as we mentioned at the outset of the presentation, nearly all previously declared open defecation-free villages experienced slippage, and there was reportedly prevalent open defecation practices occurring in the communities. However, it's important to note that many households maintained and replaced latrines. However, they remained of a very poor quality. And based on observation, when we talk about poor quality, we're talking about lacking slabs, roofs, walls, so major superstructure components, which is, has a lot of implications both in terms of use, dignity, and across, an array of areas. And so, we know that CLTS is aimed to end open defecation and doesn't focus on quality, but nonetheless, at evaluation site after evaluation site, respondents and interviewees talked about a cycle that they're in of poor latrine quality leading to frustration of a constant rebuilding cycle. So some cited, every few months, some cited, multiple times a year. And there's often, we have lots of quotes about things blowing down in the wind or floods happening, that essentially these are not durable or long lasting latrines, which certainly stymies changing behaviors around sanitation. So, latrine quality was stymied by a lot of things, financial constraints being primary among them, which we'll discuss on the next slide, so I won't belabor it here. Also, lack of available materials. So cement came out and emerged across all the evaluation sites as the most important material that was lacking. And then, of course, there's varied community norms. Both in the qualitative and quantitative findings across the sites, households really, it was clear that they understood the importance of sanitation. The knowledge is there once again. So CLTS and FAST really, they do give that knowledge, right? Or households had it, but it didn't necessarily internalize that knowledge to change their habits, right? As we're seeing the slippage to open defecation, there's not consistent latrine use, and it really doesn't appear that there's normative behavior change happening in a majority of these intervention communities, which signals that the behavioral drivers haven't been addressed. I won't belabor the point, but obviously, if we're having still there's open defecation occurring and the latrines are unimproved with low community coverage, there's likely limited health benefits there as well. And so shifting topics a little bit, we're staying with sanitation, but away from CLTS, we're going to talk about the trained mason piece. And there's some positive news here. So they, were reportedly still in high demand in Senegal, Madagascar, and Mozambique. 31% of households in Mozambique said that they used a trained mason to construct their latrine, and 35% in Madagascar said they used a trained mason after the activity ended. However, this still had little to no effect on kind of the overall access levels that we were seeing in communities. And it's also worth noting that, very poor households are likely not using them. And this was reported across several evaluations as well. So ultimately, we see that CLTS didn't eliminate open defecation in the long term, and communities are relying on poor quality latrines overall, and triggered households didn't generally progress towards improved or basic sanitation, meaning they missed out on potential health gains in the long term. So we'll move on to the next and final slide. Thank you to all of you who are sticking with us through these findings. And we're going to talk about the financial barriers and really interesting the final piece about the Senegal example. And so, essentially the financial barriers were the major barrier to sustain latrine quality and use, and also to maintenance, and reconstruction as well. And so I'd like to draw your attention to this figure, which shows data from the Senegal PEPM intervention or activity that we evaluated. And as I mentioned earlier, we had the opportunity to compare the long-term sustainability of 3 different scenarios. So there's pure CLTS, which if you look at the key is in dark blue, subsidized latrines combined with the sanitation marketing approach, which is in light blue, and then a hybrid of the CLTS plus subsidy, which you can see in gray, and you can note that the totals are in red. So when we start out going from top to bottom, when we look at what appears to be in use, we see that CLTS does the best, right? They're all decently high, but CLTS definitely comes out as performing quite well. When we move down to looking at the second indicator, which is any slab or any latrine with a slab, we see that CLTS numbers drop. And please note that it's a statistically significant drop, right? And subsidies are performing well or the best. Hybrids, it's not too far behind when we look. And really, when we think about the last two indicators, there's a story to tell. While it's not a stark difference, the hybrid model provided the best balance among the approaches, and that it allowed for both higher quality initial latrines that last, latrines that basic sanitation, and they were more commonly repaired. And so, well, again, it's not stark, it's something. And certainly we as a sector, we need to find these shining moments or shining, data points and look at them and see what we can learn. And so one of the things that emerges from this, which is targeted subsidies, which, they may be necessary, and many stakeholders, ranging from everyone who really spoke to, from community members to NGOs, to district and provincial government officials, said that subsidies were going to be necessary to really ensure that everybody was reached with sanitation, with basic sanitation. And so there has certainly been controversy over subsidies, with some viewing it as antithetical to kind of a pure CLTS approach. However, as I think I just noted, it's clear that CLTS alone is not sufficient to push the sector forward, to reach the SDGs, to get to basic sanitation, which is so important. And in USAID's own recent CLTS review concluded that there certainly is a disconnect between consumer demand and price that needs to be addressed, that ties into this as well. So really, in sum, the financial barriers served as this major impediment to sustain latrine quality, to maintenance, and to use. And targeted subsidies combined with CLTS in Senegal offered a modest improvement to sustained outcomes, which is worth noting and thinking about. So that really wraps up our synthesis of the ex post evaluation findings. We look forward to answering the many questions that I've seen come in during the Q&A and kind of digging into some of the nuances a bit more. This is certainly a high-level overview. And I'll hand it back over to Abby to share USAID's reflections. Thank you.
Thanks, Holly. Yeah, suffice to say, these findings have really prompted us to take a long look in the mirror. Slide. On the one hand, we remain deeply proud of the achievements we've accomplished to date, together with our development partners, in delivering first-time water and sanitation access to people the world over. What we've been able to do in partnership with many of you on this webinar is truly staggering. Yet, on the other hand, we recognize that despite tremendous achievements within the life of our programs, they've largely not endured. This is especially the case in countries and communities with the highest level of poverty at baseline, where the agency's resources are needed the most. Rural water systems that at activity close delivered safe water to households have fallen into disrepair. Basic latrine ownership and use have dwindled. Communities certified as open defecation free are backsliding, and gains in hand washing have not been sustained. Importantly, the series did reveal some programming bright spots, predominantly in countries with higher levels of development from the outset. Where USAID invested in providing technical assistance to committed government partners and utilities, gains in service provision and local capacity were sustained, with local partners taking up and expanding upon best practices introduced during activity implementation. Slide. I think it's safe to say that these results are probably not all that shocking to many in the sector. In the course of the roughly 15 intervening years since most of the activities evaluated in this series were designed, the sector really has evolved. For instance, in resource-constrained environments, the sector is now coalescing around facilitating the development of professionalized support to community-managed rural water schemes in various forms, rather than expecting voluntary committees to manage essential services alone. Additional approaches beyond community-led total sanitation, including smart subsidies and market-based sanitation, are seen as necessary to move households up the sanitation ladder and are being applied through USAID programming. And the agency is shifting its WASH social and behavior change programming to more holistic approaches that put less burden on households through provision of professionalized WASH services and address emotional drivers, convenience, and social norms to modify intractable behaviors rather than communication or health promotion alone. I think this WASH ex post evaluation series validates why those shifts were so essential. Slide. So what are we going to do differently as a result of these findings, and what's possible within the life of a 5-year activity to really incentivize actions we know will enhance durable or sustainable outcomes? First and foremost, under the USAID Water and Development Plan, in support of the Global Water Strategy, USAID pivoted to reflect early findings from this series, as well as other important work we're funding centrally through the Sustainable WASH Systems Learning Partnership, SWS, WASH Partnerships and Learning for Sustainability, or WASH PALS, Water for Africa through Leadership and Institutional Support, better known as WALLIS, and the Sustainable Water Partnership, or SWP, among others. The plan moves the agency away from simply providing taps and toilets to focus on high-impact interventions at the right scale. This includes building professional water and sanitation service providers that reach entire districts at scale and takes the burden off of households. Moving beyond direct service provision to focus on water sector governance and finance, and investing in water resources management to mitigate water stress and future-proof against rising water stress. This will help partner countries better cope with rising pressures on freshwater resources and build resilience to future shocks and stresses. Slide. We're also taking forward these findings, among others, through a few technical products, including a series of technical briefs that you can find on globalwaters.org on topics ranging from urban sanitation to gender equality. They reflect USAID's preferred approach to activity design and implementation. More will be published in the coming months, so stay tuned. We also have a forthcoming water security, sanitation, and hygiene implementation research agenda that identifies and prioritizes sector-specific research questions to close lingering evidence gaps directly related to accomplishing USAID's goals of increasing access to sustainable water and sanitation services. In terms of procurement reform, we're also thinking about ways to structure targets such that they don't create perverse incentives to focus only on first-time access. We're also hoping to consider more meaningful and strategic sequencing and layering between WASH activities and other USAID-funded work, particularly in countries and communities with the highest level of poverty at baseline, where our outcomes from this series, at least, were least durable to achieve holistic outcomes. Putting these recommendations into action is going to take all of us, from partner governments to implementing partners to the private sector. We really can't keep doing business as usual and expect different outcomes, or making tweaks at the margin and expect radically different results. So back over to Liz to facilitate what I hope will be a rich Q&A session.
Great, thank you, Abby, and thank you to all of our presenters. That was really great. I hope all of you in the audience also found those results really interesting. We got a lot of questions and comments in the question box throughout. I want to apologize in advance that we likely are not going to be able to address all of these, given how many came in. And so I just want to highlight that we do have all of the ex post evaluation materials available on globalwaters.org. Maybe one of the organizers can put the link to the ex post evaluation page in the chat box. And so, especially for those of you who asked questions about specific findings from each of the evaluations, there is a report, a short brief, and a webinar available for each of the 6 ex post evaluations. So if we don't get to answer your question today, hopefully you'll be able to find your answer in one of those materials. So I'm going to kick off with a couple of questions that came in early on for our evaluation team from Social Impact. And for this, we may want to go back to one of the early slides with the overall findings. The questions that came in were first, Did your evaluations only consider the USAID indicators for each project, or what other indicators did you look at? And the graphs that were presented at the beginning showing hand washing, functional water points, access to sanitation, could we go back to those and explain what those are showing? Are they the end line coverage, the change since the end of the project, or what? So I don't know, maybe Holly or Leslie can take that question on.
So the question, this is Leslie, is the question is just what is this reflecting? So these are the
what were these outcomes?
Right. Yeah. So these were the findings at the time we visited them at ex post. So these graphs don't show what the end line value was, although we referenced those in the talking points in some cases. And I will say that if you look at the synthesis report itself, which is available in the handouts, you'll see a lot more detail, the reference points from end line where they do exist. And in the case of Madagascar, where we had a comparison to end line that was very direct, there's actually another graph that shows the level of change between those two data points and even references the baseline of RANO-HP. I hope that answers the question.
Great, thank you, Leslie. So on to a bigger picture question. I'm going to ask Abby to respond to this one first, and then maybe the evaluation team can also weigh in. Can you expand on the enabling environment factors? So what was it about the enabling environment in the different countries that was prohibitive to the interventions achieving long success, or maybe enabled long-term success?
Yeah, I mean, I think first and foremost, I mean, we can't walk away from the fact that the most durable outcomes came in the two countries that had sort of highest level of development from the outset, India and Indonesia. And I don't think that's a coincidence at all. I mean, I will say that our programming in those countries was radically different. As a result, I think, of their level of development. I mean, we chose to kind of work at that higher level of governance and finance to a certain extent, rather than in trying to do service delivery provision directly ourselves. And I think because of that, the outcomes from those two activities were far more durable than in other places. So I think kind of at its most basic level, it might have been both a function of baseline development, but also as a result, our programming and our programming choices. And I guess I would challenge us to think about whether or not we can make the same kind of programming choices to work at that higher level of governance and finance in places that maybe have what we call, in terms of our journey to self-reliance, matrix at the agency, lower levels of country commitment and country capacity to implement.
Great, thanks, Abby. I don't know, did anyone on the evaluation team also want to expand on the difference in the enabling environments?
This is Kari. I can just chime in to say that, I mean, unfortunately, a lot of the ex post evaluations weren't, because none of the intervention, or I shouldn't say none, most of the interventions weren't specifically focused on, say governance, that our ability to fully examine those issues is more limited. But I think, you know, where these issues came up, you know, the things we discussed, like about tariffs, about the policy environment. One thing that didn't come out in the slide deck, just unfortunately we were limited in time, but is also land tenure issues. And then obviously what your predominant management arrangements are, kind of getting to that roles and responsibilities question, are also kind of those key factors that we ended up finding to be quite important.
Great, thank you. So someone noted in the questions that these evaluations all took place in settled communities where we were able to go back and find the same groups of people 3 to 8 years ex post, which was intentional. We did not try to evaluate any sort of humanitarian interventions in this series. But the question for, I think, Abby in this case is, do you think the findings are transferable to less settled communities, for example, fragile or conflict-affected areas?
Yeah, I mean, I think obviously programming in fragile contexts is quite a bit more complicated. But I think maybe what I said previously about challenging ourselves to think about ways to work creatively in places of lower capacity and commitment at that higher level of governance and finance is maybe even more true. I mean, working at the systems level is hard always. But, I think in terms of a fragile context, there are a few key things that I think we should be thinking about. And one is promoting sort of shock responsive programming and adaptive management where we can. I think also in non-permissive environments, we really can't be afraid to use sort of traditional development, well, I shouldn't say traditional development approaches, but development approaches that sort of take this more systems level approach. And I think we need to think too about sort of synergistic programming approaches in terms of bridging kind of the humanitarian to development divide. I think it's going to be hard, but I do think a lot of the results that we found in this series are transferable. We just need to be more creative.
Great, thank you for that, Abby. I'm going to direct the next series of questions to Holly, I think, to respond initially, and then if anyone else wants to jump in. We got several questions about CLTS and the sanitation findings we had. So I'll sort of group these for you into 2 sections. The first is about the CLTS approach in general and the types of toilets we ended up seeing. So we saw that we didn't have great outcomes in Madagascar, Mozambique, and Senegal. And was there any improvement in the type of toilets used over a period of time, or any changes from what was initially promoted to what we saw ex post? And then any thoughts on the question of whether you agree with the assertion that the non-technology prescription principle of CLTS contributes to the slow progress and low coverage, since we end up with unimproved latrines often from CLTS, which are then not counted. So Holly, your thoughts on those?
Yeah, certainly, thank you. So in terms of CLTS and the types of toilets and seeing improvements, we, and Kari and Leslie, feel free to jump in, but we did not, we'd have to know and have observations from the actual end line for a direct comparison. That being said, we didn't have those in most of the evaluation series. What we can say is that of the ones we did observe, and again, if you look at our sample sizes, especially in Mozambique, for example, and Senegal, they're in the 800-900s, observations of 800 or 900 different latrines. In some cases, they generally were not of high quality. And really, if you look at our detailed reports, you'll see that many of them lacked critical components, not just to get to basic sanitation like having a slab, but the superstructure pieces, walls, roofs, doors, locks. Many of those pieces were pretty dismal in most cases. Where we found, I think the one difference is in Senegal, where we had the opportunity to look at and see the hybrid approach and the subsidy approach. So those in those communities that had both the subsidy and hybrid approach, there were more latrines that were of a higher quality that were still able to be observed when we went back 4 years ex post. So does that answer that question, or does anybody else want to chime in on that before I go to the non-technology piece? I'll take silence as all. Okay, great. I'll go on. Yeah, so sorry, can you repeat the non-technology piece? I just wrote down half of it, but didn't all of it. Sorry about that, Liz.
Yeah, I think the other half of it was about thoughts on the non-technology prescription principle, and whether that's causing some of the challenge in the eventual numbers we see of improved latrines.
So I think certainly, in my take on that is absolutely. I think with CLTS, the goal is to end open defecation, right? And then obviously to end open defecation, you need access to latrines, but really it's not to move people up the sanitation ladder, to get people to basic sanitation, to make sure that there's a slab there, and so because of that, obviously it certainly is I think a barrier and a challenge. So the answer would be yes. Thank you.
Great, thanks, Holly. Did anyone else want to chime in on CLTS and the quality of latrines questions?
I would just say, and I think Holly alluded to this, but there was a fairly comprehensive study done by WASH Pals that documents a lot of these challenges. So what we found is very much in line with consistent evidence that's coming out about the challenges of CLTS. So I would encourage people to look at that as well if they'd like to learn more.
Great, thanks, Leslie. Another CLTS question we had here, and we also had this question, I think, more broadly, is how do we know if the failure is due to the methodology that CLTS itself, or for some of the other interventions, community management or the SBCC approaches? Was it a failure of the methodology, or was it a failure of the implementation? Noting that sometimes there's situations where a similar approach does work, and sometimes it doesn't. What can we say about implementation methods as part of the cause here?
Certainly, so I'll take this, but I would love for Leslie to chime in as well. So, across the ex post evaluation series, one of the challenges is we're not always able to dig in deeply to the nuances of how implementation occurred, right? We often are able to understand what approaches were used, but not necessarily the details. So I don't think that we can speak definitively to whether it was a failure of implementation or not. What I do think we can say pretty clearly, though, is that what is our goal as a sector? Is our goal to just eliminate open defecation, or is it to do that in tandem with moving towards basic sanitation? Right, and so if that is the case, I kind of would make the argument that the methodology of CLTS, while important, is not necessarily going to get us where we need to go based off of our findings. And again, if you look at the WASH PAL study, it's not just us. I think there's a lot of research now to back that up, coming out of multiple different research institutions as well. And so to me, it's not just the methodology piece, but does that methodology actually get us where we need to go? And does it need to be augmented or modified in some way, or combined with some other methods to really see where the overall goal is in the sector, which is meeting SDGs and not just ending open defecation, but getting to basic sanitation and progressing up the sanitation ladder. Leslie, over to you if you have anything to add.
No, that's exactly what I would have said as well.
Wonderful. Over to you, Liz.
Great, thank you both. I'll shift gears a little bit away from sanitation and over to rural water. We also had a number of questions and comments on this. I think the big question really is if community-based management did not sustain long-term water service delivery, what is the alternative? And I think, we also had a second comment noting that the community management doesn't work, that's clear. and has really been for some time. So what does work? So maybe Abby, do you want to say anything about this one to start?
I'll kick it back to you, Liz.
Okay. Yeah, I think this is a big question, and as some people noted in the chat, it's not a brand new question. I think some of these failures, some of the statistics I cited at the very beginning, have been known for some time. And the question is really, how do you support a community management committee with a more professional service provider in a way that then takes that burden off of the community? And this is something USAID is exploring with our Sustainable WASH Systems Learning Partnership, where we're looking at private maintenance companies that sign performance-based contracts with the community. So the community still has the decision-making power about signing that contract. They still have the responsibility of collecting fees, but those fees are then paid on an annual or a monthly basis to a professional service provider who guarantees repairs within a certain amount of time and really takes that burden off of the community. And so that's something we're exploring. There are lots of other versions of professionalizing service provision for rural communities, some involving the private sector, some involving the public sector with more of a rural utility model. And I think there's still a lot of work to be done on understanding how to make that kind of system work and understanding what kind of policies you need, what kind of regulations you need in that system. Our Senegal experience from the Expo series did start to set up this type of system with private maintenance providers, but we found that at Expo, those contracts had fallen by the wayside because there wasn't that proper regulatory and oversight role. Communities didn't see the benefit of having that contract in place. And so while there were still private sector entities available to do repairs, they weren't functioning in that sort of performance-based contract modality. And this is something we go into in our rural water technical brief that Abby mentioned at the end, which is also available on Global Waters. Does anyone from the evaluation team want to weigh in on the rural water maintenance question?
Sure, would be happy to. I mean, I think you covered a lot of the points that, to date, the majority of rural water projects have been based on, this community-based management model. And so there haven't yet been as many opportunities to study. Me being an evaluator, I look at things from that perspective. And, we're, as a sector, I think we are still exploring, what can that look like, a more professionalized service? How do we do that well? How do we make sure that that is resulting in, sustainable services? There's potential options for things like PPPs. How do we do those well? What are kind of the right components? So from my perspective, I think this is really, I think there's some good directions, and we look forward to looking at how those all play out in the future.
Great, thank you, Kari. A couple more questions on water services that I'll direct to the evaluation team. One was on, can you say anything about the different service levels of water that people were having, and what our evidence says about how that might affect sustainability, and also anything you saw about willingness to pay between some of the rural versus urban settings and how that fee structure looked different.
Sure. So I'll actually start with that, the latter point. So in a couple of cases, we were able to look at differences in what people were paying across at least urban/peri-urban areas and then more rural areas. And we did find that in urban areas, people were, so this is based on in part Senegal and then also Mozambique, that they did tend to pay more. Now, we aren't able to say with 100% certainty why that is. In part, we suspect that has to do with the types of systems that are installed. You know, if we're talking, you know, boreholes versus more mechanized pump options. In Senegal, we actually were able to look at this difference in the pump type. So it was less about urban versus rural, but rather about the different pump types. And we did find that those who were using mechanized pumps were paying more, substantially more actually. And if you combine that with the general likelihood that those are somewhat more common in peri-urban and urban settings, you know, that is likely playing into it. So I will say that as the ex post series, I don't think we were able to fully explore that question, but we did have, you know, some instances where we were able to kind of look at those variations. And in terms of service levels, so I mean, in all of the cases, the activities that we covered were installing improved water sources. We definitely, though, were able to look at potential effects of kind of the existence of unimproved water sources. And we did find that that was a notable challenge, particularly in collecting water fees and being able to collect sufficient water fees. That in areas where people had better access to, whether it was unprotected wells or if it was lakes, other types of surface water sources, natural springs, that kind of thing, that it was harder to convince people to pay for water. You know, why would I pay for water if I can get it for free? And so that ultimately, kind of in an interesting way, that this kind of ready access to unimproved water sources actually then in some ways has a negative effect on the ability to sustain an improved water source. So that was kind of an interesting nuance a little bit that we found regarding the different kind of service levels.
If I could jump in, Kari, just to add, if all of our evaluations where possible, we tried to measure the level of access to basic service according to the JMP drinking water ladder. So I would encourage people to go to the reports. So we, you know, tried to provide an estimate as best we could gather data for drinking water from an improved source, provided collection time is not more than 30 minutes for round trip collection. So you can find some more specific results on that in the reports.
Great, thanks, Kari and Leslie. And I would just add that in the rural context, we were looking at basic services where people had to walk to collect water. In the urban context, Indonesia and India, that's where we were looking at water that was piped onto premises, which may or may not have reached the full criteria for safely managed. But you know, we did see better results in those urban contexts, but I don't know that we can fully say that that's just because of the service level, since, you know, they were also operated under a utility model. They were in countries with more favorable enabling environments for service provision. So it's a little hard to pull all of that apart, but, you know, clearly we did see better results in those urban contexts where the water was piped. I'm gonna shift gears again a little bit, and I think throw it back to Holly for some questions on hand washing and behavior change. I think the first question is maybe a clarification. In the ex post evaluations where we were looking at promotion of hand washing, was that all promotion of tippy taps? Or did we see anything else in terms of promoting a different technology for hand washing?
Yeah, so thank you. That's a fairly easy one to answer. So, with the exception of Ethiopia, but in the other rural sites, Madagascar, Mozambique, and Senegal, tippy taps were what was promoted. They were the hardware that was promoted. Certainly, they promoted hand washing with soap at critical times, but in terms of a hardware, it was tippy taps. And traditionally, what's used in all of those environments are kind of pitcher and basin or kettles, things like that. So it was a transfer from that type of hand washing device to a tippy tap was what was promoted and encouraged. Thank you.
Great, thank you. And next question on hand washing. Can you offer any insight into why hand washing with soap rates were so much higher in Senegal? If we're saying we had 30% sustained hand washing rates as a result of our interventions, it sounds like that's not such a low number. It's maybe not ideal, but it's significantly better than we saw in other cases. So any thoughts on why that might be the case?
Yeah, no, I mean, I think it's a great question, and I welcome Kari to come in on this as well, as she worked closely on the Senegal evaluation. But I agree, especially when you look at it, when you look at the the figures with the other sites. Of course, we're all looking at different times since ex post. Senegal was about 4 years later, and not to dovetail, but if you look at sanitation as well, the access in Senegal is also much higher. And what's interesting is that the community promotion piece was less clear to us, like what was happening in terms of ongoing promotion in Senegal. And so, I don't know that I have an exact answer for why we're seeing that, other than that on other indicators as well related to sanitation, for example, in terms of overall access, those performed better as well. It is worth noting that in Senegal, we didn't touch on it because obviously you can't get into everything and all the nuances and details, but Senegal also had a kind of a broader social marketing component to behavior change promotion. So they had like radio spots and things like that, in addition to FAST and SARAR. So that could have played a role. Certainly, I can't say anything definitive, but there were some added pieces there as well that happened during implementation. So I don't know, Kari, if you wanted to jump in as well.
Yeah, thanks, Holly. I mean, it is a little bit hard, given the nature of the evaluations that we were able to do. That we're not always able to attribute all of what we see, just given there are a number of factors that are different. So the activities themselves had slightly different implementation approaches. I think, as others have alluded to prior, we usually knew the broad strokes of those implementation approaches, but we didn't always know the details. So certainly those are potential factors. But then also other factors would just be prevalent, like kind of baseline prevalence within the communities as well. And different countries and even different regions within those countries have different rates of access, different rates of kind of a baseline practices as well. And so I think all of these factors could be playing into that.
Great, thank you both. And a question over to Abby on this topic. What are your thoughts about other approaches for improving people's appreciation of services and value through better communication strategies and perhaps using behavioral economics? Any thoughts on alternative approaches we could be using there?
Yeah, I mean, I think what this series has really shown, I think in somewhat, stark relief, is that our efforts to stimulate behavior change and somewhat complicated behaviors really via communication and sort of this messaging around health promotion and benefits alone really isn't moving the needle in the way that we'd like to see. And so I think kind of thinking about, at least in the social behavior change space, about the emotional drivers convenience and social norms are really important. And behavioral economics, I think, has certainly a role to play in helping us unpack some of those norms. I think there's also, as I mentioned before, this need to, you know, just generally think about professionalizing water services in particular, and sanitation services, such that these behaviors that we'd like to see are easier for people ultimately at the end of the day. And I do want to plug again the fact that on Global Waters we have a forthcoming tech brief specifically on social behavior change coming out soon. So please be on the lookout for that, where we kind of articulate in detail some of those key approaches that we think might help move the needle going forward.
Great, thank you, Abby. One more somewhat detailed question, but I know this is of interest to a lot of people, is on the e-governance aspects of the FIRE-D activity in India. So I think this is probably for Leslie. Can you explain more what those types of interventions were and how they worked?
I can do my best. So what we gathered from you know, digging back through what we could find in activity documents was that it varied quite a bit. And essentially it's a variety of types of services or features that were available to utility customers to, you know, submit complaints if their service wasn't working well, to report if there was a leak, or to pay their bills, other things that kind of brought conveniences and more immediacy to attending to issues with water access. And it took different shapes in different municipalities. I presume based on the needs there and what might have already been going on. And I'll say that, you know, this FIRE-D didn't invent e-governance. It was, you know, something that was already kind of being rolled out in various ways, and FIRE-D assisted in these, you know, selected states and municipalities to help roll it out. And I think features continued to be added in different cities where it was adopted. So I think it ranged quite a bit.
Great, thank you. Hope that answered the question. And just another plug that, you know, we do have the full reports on Global Waters, and I know the India report goes into quite a bit more depth on that topic than we were able to get to here. A question, I think, both for Abby and for the ex post team is really how these differ from a typical ex post. Are we seeing consistent conclusions with other research studies, or are we seeing anything really different?
I'm happy to start. I mean, I am unfamiliar with other ex post evaluations done in the WASH sector, other than the one done a few years ago by Plan International. And so I think these are somewhat groundbreaking in a way relative to their methodology. I know, and perhaps Kari can speak to this, that the MCC does do ex post evaluations as part of their normal process, and they have done a few large compacts in the water sector. So perhaps you'd like to speak to that, Kari.
Sure. Yeah, I think something that was really interesting about this ex post series is, as Abby was just noting, is that it was a new approach to looking at the effects of USAID's investments. You know, oftentimes, you know, a final evaluation is conducted around the end of the project, and you don't have that opportunity to look longer term. And so it really offered that opportunity. I think, yeah, there are some other organizations such as NCC that have a longer history of doing ex post evaluations. In terms of the findings, I mean, I think, the findings of any given evaluation tend to be particular to that one, to that particular evaluation. So I'm not sure how many of the specific findings we could compare in that way. I can say, just regarding the broader literature, which would obviously include both ex post evaluations, but other types of studies as well. I mean, we have lots of different findings. I think a lot of our findings are consistent. I can speak most to the water end, and my colleagues can jump in on the other pieces. But regarding kind of the failures of community-based management, for instance, I think that's something that is becoming more and more established across the literature. The challenges of collecting water fees, things like that. I think those findings are all echoed more broadly within the literature as well. I don't know if Holly or Leslie, you want to jump in on kind of other types of findings and how consistent they were with the broader literature.
No, I think you covered it well, and we had referenced what limited findings there are from an ex post perspective. We tried to share those in the reports. I will say, on the ex post evaluation in general, we learned that unless an ex post evaluation is kind of planned from the outset, it makes it a bit of a difficult endeavor to actually go through and do a rigorous study. We were really pleased that we were able to do what we were in these 6 contexts, but it was a significant undertaking in each case to review all the project documentation to figure out what happened in which specific locations, and what the end line results were. And a lot of times it's a long process of cobbling all that together. And that's all to say that, just a plug for those who are in a position to be able to do that, documenting very clearly what projects are doing when and where, and what the end line results were, and having data sets available goes a long way, even if it's not initially planned, but it opens it up for an ex post opportunity at a later time. And Madagascar was a great example, and I commend Catholic Relief Services for having such a rich data set and clear documentation. It really enabled us to have a very clear look at, what's the level of slippage in a concrete way. So more examples like that would be very welcome to enable more ex post studies like this.
Thank you. Yeah, thank you all for the thoughts. And Leslie, that's a really good reminder that doing ex post is not an easy undertaking, and that this was quite an effort to get these. So kudos to the evaluation team for being able to pull that all together. We're running out of time, so I want to throw one final question to Abby, and this is kind of a big picture question. Given that we have good evidence from here, from these ex posts, it aligns with a lot of the literature. Over the 5 years that we've been doing these ex posts, more data, more evidence has come out around some of these interventions and some of the weaknesses. But what will it really take to get the WASH sector to pivot? Some of these types of approaches seem really ingrained. So what are we going to have to do to make that pivot, both as USAID and as a sector altogether? So Abby, any final thoughts on that?
Yeah, I think at the end of the day, and as I think was pointed out to you in the question box, for all of the failed approaches that we pointed out in this series, we can all think of situations where similar approaches actually worked. And so I guess I would challenge us a bit to think about whether or not those instances where it worked, are those outliers? And are what we're pointing out through this series really kind of the norm? Because I would argue that despite some small sample sizes in some of these studies, the literature and this series is really pointing to the fact that a lot of the approaches that we once thought were the way to go aren't delivering the durable, long-lasting results that we had hoped, and really that we saw at Activity N-Line. So we were, just as much as our partners and the host country governments with whom we work, we're excited about kind of the activity's success. I mean, are finding that as we've gone back, we've seen slippage and failures really. And so I think it is going to take all of us kind of being a little bit more objective about kind of what we're doing in our programs, and taking a long look in the mirror and working together to try to really embed new thinking in the way we work. Sometimes that's going to take policy changes in countries where we've convinced folks through our own advocacy, really, that they take an approach such as CLTS or community managed water systems, and they've ingrained it within their policy documents. So we're going to have to help move the needle on that together with all of you. As USAID, we're very committed to trying to make those changes, but we can't make those changes alone. And so we look to you to help us move in that direction. And we're very much looking forward to the next couple of years of trying to work that out. And yeah, so with that, I just want to thank everyone for participating. Liz, if you have any final comments, please, back to you.
I just want to also say thank you to all of our presenters, panelists, and attendees. It's amazing to have so many people hang on to the end of a 2-hour presentation and Q&A session. Apologies again that we couldn't answer everything, but I do hope this is not the end of the conversation around where we take these findings and what we do next. As Abby highlighted, we have a forthcoming water and development implementation research agenda where hopefully we can dig into what we do about some of the findings we found in the ex post series. So thank you all, and looking forward to talking again soon.